Valence syndrome is characterized by all of the following except A. Critical stenosis of left circumflex coronary artery, B. Critical stenosis of left anterior descending coronary artery, C. T-wave abnormalities in leads V2, V3, D. ECG abnormality noted mostly in symptom-free period. Correct answer A. Critical stenosis of left circumflex coronary artery. Original description from Valence group date back to 1982, though the eponym came later. They noted the pattern in 18% of their 145 patients with unstable angina. In spite of symptom control with nitroglycerin and beta blocker therapy, they noted that 12 of the 16 patients who did not undergo revascularization surgery in their case developed extensive anterior myocardial infarction within weeks of admission. False statement about aliasing. A. Aliasing is described in Doppler echocardiography. B. Aliasing occurs when the velocity being interrogated is below the Nyquist limit. C. Nyquist limit is half the pulse repetition frequency of the Doppler transducer. With aliasing, the direction of flow can appear as opposite to that of the actual due to wraparound. Correct answer B. Aliasing occurs when the velocity being interrogated is below the Nyquist limit. Aliasing occurs when the velocity being interrogated by Doppler echocardiography is above the Nyquist limit. Continuous wave Doppler recording showing aortic regurgitation AR jet above the baseline with a cutoff at the upper end and a wraparound seen below the baseline. Here the aliasing is seen because the limit has been set just about 200 cm per second while the velocity is higher than that. The tracing can be depicted upwards to its full extent by adjusting the velocity limit or by adjusting the baseline downwards. If the velocity range is lowered below 200, AR jet will appear above and below the baseline in a similar fashion as is seen above the baseline now. This is because a second wraparound occurs at the lower end below the baseline. It is in that situation that identifying the actual direction of the jet becomes difficult. The dense jet seen below the baseline is the forward aortic flow. The peak forward gradient is measured as 20 mm of mercury, which does not indicate significant associated aortic stenosis. Chatterjee phenomenon is A. T-wave inversion occurring after an exercise test, B. T-wave inversion in anterior ischemia, C. Post-pacing T-wave inversion, D. None of the above. Correct answer C. Post-pacing T-wave inversion. Post-pacing T-wave inversion has been called Chatterjee phenomenon. In the original article by Kanu Chatterjee and Associates, they found significant ST depression and T-wave inversion persisting after discontinuation of pacing. They noted that the mere presence of the lead in the ventricle or atrial pacing did not produce these changes. They also excluded a recent Stokes-Adam attack as the cause of the STT changes in their cases. Only depolarization of the ventricles from an abnormal site was deemed to be the cause of these changes. Cardiac memory has been postulated as a mechanism of these changes by other authors as well. Similar changes have also been reported after intermittent left bundle branch block, intermittent pre-excitation, and episodes of tachycardia, post-tachycardia syndrome. In Epstein's anomaly of tricuspid valve, A. Septal and posterior leaflets are displaced distally, B. Septal and posterior leaflets are displaced proximally, C. Anterior and posterior leaflets are displaced distally, D. Anterior and septal leaflets are displaced proximally. Correct answer A. Septal and posterior leaflets are displaced distally. Epstein's anomaly is characterized by the distal displacement of the septal and posterior leaflets of the tricuspid valve. The anterior leaflet is not displaced and hence is quite large and sail-like. Closure of the large anterior tricuspid leaflet produces the sail sound characteristic of Epstein's anomaly. The distal displacement of the tricuspid valve causes atrialization of a portion of the right ventricle. Which of the following is not a part of Williams syndrome? A. Supravalvular aortic stenosis, B. Elfin facies, C. Hypercalcemia, D. Valvular pulmonary stenosis. Correct answer D. Valvar pulmonary stenosis. Williams syndrome is characterized by supravalvar aortic stenosis, Elfin facies, and hypercalcemia. Learning disability is often associated. Peripheral pulmonary stenosis is also an association. In supravalvar aortic stenosis, the right upper limb blood pressure can be more than that in the left upper limb because the jet is directed towards the brachiocephalic artery. This is known as Coanda effect. Target heart rate for aerobic training is A. 140 per minute, B. 120 per minute, C. 70% of maximum predicted heart rate, D. 90% of maximum predicted heart rate. Correct answer C. 70% of maximum predicted heart rate. Aerobic exercises are those which stresses the oxygen transport system, while resistance exercises stress the musculoskeletal system. Target heart rate for aerobic training is 70% of the maximum predicted heart rate. Maximum predicted heart rate is 220 minus age of the individual. While doing a treadmill exercise test, often we aim at above 90% of the maximum predicted heart rate. But when a treadmill test is done for risk stratification soon after myocardial infarction, pre-discharge, seldom done in this era of early invasive management, only a target heart rate of 70% of maximum predicted heart rate is aimed. During aerobic training, the target heart rate is kept at only 70% because it is not possible to maintain maximum predicted heart rate without exhaustion. In treadmill test, the maximum predicted heart rate is achieved only for a short period of time at peak exercise, and then the cooling down recovery phase follows. But in aerobic training, the target heart rate is maintained throughout the regular training period, which could be 30 to 40 minutes. Aerobic training also starts at a lower level with a warming period and is followed by a cooling period. Sudden stoppage of intense physical activity can theoretically even precipitate significant cardiac arrhythmia. When digoxin is given along with amiodarone, dose of digoxin: A. No dose adjustment is needed. B. Dose should be reduced by half. C. Dose should be increased by 25% to account for the interaction and loss of effectiveness. D. Digoxin should not be combined with amiodarone. Correct answer B. Dose should be reduced by half. Important drugs which can increase the levels of digoxin are quinidine, verapamil, amiodarone, and dronedarone. The dose of digoxin should be halved with concomitant use of verapamil, amiodarone, or dronedarone. Drugs with high levels of protein binding displace digoxin from the protein binding sites and increase the effective blood levels of digoxin. Monitoring of plasma digoxin levels and frequent evaluation for signs and symptoms of digoxin toxicity are recommended while using these drugs in combination with digoxin when that combination is deemed essential. Mechanism of Austin Flynn murmur in AR. A. Fluttering of the anterior mitral leaflet due to the regurgitant jet impinging on it. B. Jet can produce relative narrowing of the mitral orifice. C. Diastolic mitral regurgitation due to elevated left ventricular diastolic pressure. D. All of the above. Correct answer D. All of the above. In addition to these, elevation of left ventricular diastolic pressure causes the mitral valve to float back to a partially closed position. Commonest cause of sudden cardiac death: A. Coronary artery disease, B. Hypertrophic obstructive cardiomyopathy, C. Severe aortic stenosis, D. Brugada syndrome. Correct answer A. Coronary artery disease. Commonest cause of sudden cardiac death is coronary artery disease, contributing to 80% of cases. Angiographic measurements are calibrated using the diameter of the catheter used. Diameter of a 6F catheter is A. 1 mm, B. 2 mm, C. 3 mm, D. 4 mm. Correct answer B. 2 mm. 1F corresponds to 1/3 of a millimeter, so that 3F catheter will be 1 mm and 6F catheter will be 2 mm. Bidirectional Glenn shunt is A. End-to-end anastomosis of superior vena cava to right pulmonary artery, B. End-to-side anastomosis of superior vena cava to right pulmonary artery, C. Side-to-side anastomosis of superior vena cava to right pulmonary artery. D. None of the above. Correct answer B. End-to-side anastomosis of superior vena cava to right pulmonary artery. A bidirectional Glenn shunt connects the superior vena cava to the right pulmonary artery in an end-to-side fashion so that superior vena caval blood can flow to both lungs. Cause of right ventricular filling during right coronary artery injection. A. Coronary arteriovenous fistula. B. Coronary cameral fistula. C. Pulmonary arteriovenous fistula. D. None of the above. Correct answer B. Coronary cameral fistula. Coronary cameral fistula means a fistula draining from a coronary artery to a cardiac chamber. In this case, it is a coronary cameral fistula draining into right ventricle. Type 3 in DeBakey classification of aortic dissection. A. Ascending aorta alone. B. Descending aorta alone. C. Both ascending and descending aorta. D. None of the above. Correct answer B. Descending aorta alone. DeBakey classification of aortic dissection. 2. Ascending aorta. 1. Originates in ascending aorta and extends at least till the arch. 3. Descending aorta. Tachycardia with LBBB pattern and left axis deviation. A. Mahan fiber tachycardia. B. Bundle branch reentrant tachycardia. C. ARVD. D. All of the above. Correct answer D. All of the above. LBBB pattern with left axis deviation in wide QRS tachycardia should make us suspect Mahan fiber tachycardia or bundle branch reentrant tachycardia. The sinus rhythm ECG will be normal in Mahan fiber tachycardia, while some bundle branch block pattern is likely in bundle branch reentry in sinus rhythm ECG. Another possibility which has to be thought of is ARVD. Careful inspection of sinus rhythm ECG for epsilon wave may be useful in this case. Chronaxy is A. Minimum voltage which will capture the myocardium at any pulse width. B. Pulse width needed for capture at twice the rheobase voltage. C. Intracardiac signal picked up by the intracardiac electrode. D. ST elevation occurring in the ECG monitored from the electrode tip as the lead makes contacts with the myocardium. Correct answer B. Pulse width needed for capture at twice the rheobase voltage. Rheobase, minimum voltage which will capture the myocardium at any pulse width. Chronaxy, pulse width needed for capture at twice the rheobase voltage. Electrogram, intracardiac signal picked up by the intracardiac electrode. Current of injury, ST elevation occurring in the ECG monitored from the electrode tip as the lead makes contact with the myocardium. Pseudo-normalization of LV filling pattern is seen in A. Stage 1 LV diastolic dysfunction. B. Stage 2 LV diastolic dysfunction. C. Stage 3 LV diastolic dysfunction. D. Stage 4 LV diastolic dysfunction. Correct answer B. Stage 2 LV diastolic dysfunction. Polymorphic ventricular tachycardia with QT prolongation is known as A. Catecholaminergic polymorphic ventricular tachycardia. B. Accelerated idioventricular rhythm. C. Bidirectional ventricular tachycardia. D. Toss at the points. Correct answer D. Toss at the points. Mechanism of pulmonary hypertension in COPD. A. Alveolar hypoxia. B. Mechanical effect of high lung volume. C. Loss of small vessels. D. All of the above. Correct answer D. All of the above. Region least involved in right ventricular endomyocardial fibrosis. A. Right ventricular inflow. B. Right ventricular outflow. C. Right ventricular apex. D. Right ventricular body. Correct answer B. Right ventricular outflow. Endomyocardial fibrosis is a type of restrictive cardiomyopathy seen mostly in the tropics and subtropics. There is progressive fibrosis and obliteration of the right ventricle, predominantly the inflow and the apex. The right ventricular outflow tract is relatively spared and is often dilated. This leads to the physical finding of RV outflow pulsations, a wavy pulsation in the third left intercostal space close to sternum. The restriction of inflow into the right ventricle elevates the venous pressure greatly. ECG lead system used for treadmill test is known as A. Body surface mapping. B. Frank orthogonal leads. C. EC 5-lead system. D. Mason-Likar torso leads. Correct answer D. Mason-Likar torso leads. In Mason-Likar torso leads for treadmill, the limb leads are placed on the torso near the origin of the limbs. This produces changes in the QRS with a rightward shift and disappearance of Q waves in inferior leads. Hence, it is not useful for diagnosis of QRS morphologies.